Hi, my name is Alex Drzina. I am the founder and CEO of Evidence-Based Outcomes. And I'm super excited to be here today with you. We're going to be showing over Healthflow, one of our patient safety medication tracking RPM applications. So first, we'll just take a quick look at the sign-in page. You'll see that you just enter an email or password that you will set up yourself. And then we'll move on to your sign-up. So you can either sign up as a healthcare provider if you maybe are a nurse or you're a dialysis clinic, cardiac clinic, or a physician and want to implement this Healthflow into your practice. And here you go into the healthcare provider sign up. And then you click your role in the organization. So you could be a physician, NP, PA, registered nurse, or even just a staff medical assistant. And then importantly, you'll get an organization code assigned to you from Evidence-Based Outcomes, and that will be differentiating your specific clinic. So maybe you're a cardiovascular clinic, we don't want to mix you up with a dialysis clinic or anything like that. And then we'll go to our independent patient sign up. So these are our patients downloading the app maybe off the Android store, Apple store, or directly from our website that you can find at eve-bow.com. First, you'll just implement some just basic demographic, first name, date of birth, just so the minimum amount of information that we can get this app tailored to you. And additionally, we've also added an emergency contact field. And in this emergency contact field, you're able to maybe you're signing your mother up for this app and you want to keep a closer eye on her health and her vitals and her medication, and she's actually completing these tasks. And you may not be available 24/7, or you may live in a different continent, country, anything like that. You can actually put yourself as emergency contact or have a loved one or someone that you trust as an emergency contact, and they can also be notified with updates or any adverse effects, or just have a better understanding of what's going on. So let's get into it. We're going to sign in now. And what I really like is our dashboard. Our dashboard has everything that you need in it. If you aren't very tech savvy, you don't have to even toggle between different tabs because everything you need is going to be right here. At the top of the screen, you'll see your most recent blood pressure, heart rate, blood glucose, oxygen saturation, your most recent weight. And these can also be tailored to what you need. If you maybe want to keep an eye on your blood pressure and heart rate but don't necessarily need your oxygen saturation monitored, that's okay. That's what you signed up for, and that's what we can offer to you. Right underneath that, you'll see a medication adherence box, and then you'll also see a today's task box. And this will be where you kind of can click off your today's tasks or medications as you take them. So let's say we took our morning lisinopril, 20 milligrams. It's scheduled for the morning, and then it's going to say I took it. And then it's actually going to double prompt you to make sure you're taking it at that right time. Because what we see a lot is that patients may take their medications but not taking it consistently. So it's also going to prompt us, I understand I took it at this time. And then also you might come over to your today's task and you see, I need to check my blood pressure. And this can also be a timed today's task. So you can time that with your medication. If say you need to take a blood pressure with a blood pressure medication, it's both right here, easy to use and find. Right below that, moving down, we have a health screenings box, and that will kind of link us directly to our health screenings tab where we can go a little bit further in depth a little bit later on. Underneath, we've tried to simplify registering a new device as easy as possible. So there's two ways to register a new device. You can either download our app, use it, manage your health that way, and manually enter your vitals. And we always want to recommend that you use our Healthflow products because they're cellular. There's no integrating, no manual entering of a vital sign. That just leaves room for error out. But if you decide you just want to trial us and see if this works for you, you can download our app, use it, and manually enter as well. But say you like the app, you're like, I'm tired, I want to throw my pen and paper away and just go completely cellular. I don't want to upload, I keep making mistakes. You can add a device and it will prompt you just to enter that device serial number on the back. It's about 14 digits in length, and you will just put that there and it'll be registered and it'll be available for you to use. Moving on, we'll go down to our Health Insights tab. So I really like our Health Insights tab. It really should be what vital signs are broken down. It should be easy to read for our patients or anybody really. And so you can just have a good understanding of what your statistics are, how you're doing, and what it's looking like over time. So at the top, we'll have the blood pressure, heart rate, blood glucose, SpO2, and you can toggle between these to see different values. It focuses on one at a time, so you are not over, there's not too much information. Underneath that, you can see the manually add vital sign. Again, we want to recommend that you use our cellular products because they're already integrated with the app. They're going to work much, much better and more efficiently for you. Under that, you'll get some blood pressure statistics, and you'll see your averages, your lows, your highs, the total amount of readings. And right underneath that, we have a measure, kind of like health insight tips, measure blood pressure at the same time, daily for accurate tracking, just kind of giving the patient, the individual, just some better insight on how to better take care of their health. Underneath that, we have trends over time. So you get kind of a nice, neat, organized graph where you can see your blood pressures on a consistent basis. So you can see here in the green area, we have a lot of really good blood pressures, and then maybe the yellows kind of looking more at the diastolics, but they're still very okay values. What we really want to avoid are that red value, and we'll actually go into that. And then if the dot graph can be kind of confusing to some people because it's kind of bringing all your vital signs into one spot. So there can be a lot of dots. If you're taking your blood pressure twice a day, you'll have one for twice on December 13th. You'll have two every single time that you take it. So we've also calculated the average called the MAP, the mean arterial pressure, and underneath that you can see the maps of your blood pressure on a line graph, which might just be easier for some individuals to read. Underneath that, say graphs aren't really your thing, we just have a plain list of all the most recent blood pressures, and this can be seen over the last 3 months, last year, all time, and that is where those are. So next I want to go into, let's say you have a blood pressure that is out of normal limits. So I'll manually enter one. We'll go 160 over 110. And we just took that. And that is quite an elevated blood pressure. Well, that is an elevated blood pressure. The app will actually alert you that this is an elevated blood pressure. We want you to understand that this may need medical attention. It will prompt you, are you experiencing maybe a headache, any blurred vision, some chest pain? Say we're experiencing some chest pain. Then it will prompt us to call 911, urgent, immediate medical evaluation. We really want you to get the help as soon as possible for you. We'll click out of that, I understand. And then we'll kind of look at the heart rate graph, just kind of comparison with the blood pressure. See you have some dots. These all look really good. And then you have your daily averages as well. We've also made it extremely easy for you to provide this information. Say you're an independent patient and you want to take all these readings because you've been loving this app to your healthcare provider. You can actually export the vitals data, and you can download it, and it will kind of keep all your readings all together, very neatly organized, so that you can actually print that off and take it to your provider or email it to yourself. Next, we'll move on to the medications tab. So here, this is an awesome tab because it just kind of takes out what we saw on the dashboard and it just kind of makes it bigger, easier to read, and it also has an adherence history, which is going to become important. So here we have lisinopril. We took it this morning, but let's add a new medication. So we're going to add, let's say, metformin, and then we'll do 500 milligrams. And then we'll just take it once daily in the afternoon, and then we'll add take with food. You can create little notes that help you remember at the time when you need to take that medication. So we're going to add that medication. It's going to, and then we're going to also set a reminder. So we have it once daily for the afternoon, and we'll just make it due at 6 p.m. So save reminders. And now it will completely notify you when to take that medication. We can see here that is completely populated, metformin, 6 o'clock. And then we'll also just, for explanation, we're just going to click off both lisinoprils, and we're going to go to adherence history. This is a really cool part. I really love the adherence history because it shows us in real time what we're doing over months, days. It shows us. So here we see adherence history, 33%. So we've only taken one of the 3 medications, and we've missed a metformin dose and maybe a lisinopril dose. And then that's the daily chart. But we can also go month by month. So here, if we scroll over January, it can tell us metformin, lisinopril were missed in January. So, and it will tell you the numbers of days you also missed. Since it's the beginning of January 1st, we've only missed 0.7 days. So it's not terrible, but say we are constantly getting readmitted to a hospital, we're constantly going in for high blood pressure, and then we can refer back to our app and we see the medication adherence. Maybe in March or February we're missing lots of doses, and then we can kind of have a better idea. Or say they're completely on top of their doses, and then they might need a medication adjustment. Scrolling down to our care tasks. So we've done all our care tasks for the day. That's fantastic, but we just added metformin. So maybe we want to check our blood sugar. We'll add a task of checking our blood sugar, and we'll set that for 6 p.m. Perfect. That looks great. And then we're going to enable daily reminder notifications and add task. So it's going to actually, since we set that time for the blood sugar check for 6, it's automatically going to remind us at 6 o'clock that we need to take it. And then if you want to get reminded at a different time, you can just change it there. The today's daily care task, it's just very simple. It just really keeps it all together and just makes it just super user friendly. Next, for our patients that want to take it one step further, we'll go to the Health Screenings tab. And then this tab will have a lot of really just valuable information where you can see maybe different screenings that you would be interested in partaking in. Like we have a nutritional screening. And these can all be done from the comfort of your own home. You don't need to get up. It just kind of gives you some suggestions, find a quiet place, answer all questions. And then over time, you can actually see your history on your nutritional screenings. So we'll go through the nutritional screening here. It's submitted, and then we'll view the history. And it keeps a good history, and it can show progress over time if you're improving with these screenings. If you're noticing that you're not feeling much better after the screens, then you can bring these to the attention of your provider as well. Next, we want to make the information as easily accessible as possible. So we'll go to our Resources tab. Here we have broken down everything from using the devices to common conditions to mental health. We have everything just neatly organized so you have it available to you. And then we also have some downloadable guides that you can actually download and print off yourself to kind of help have it in that paper form if you do enjoy that material aspect. So we have the blood pressure monitor and setup. We've color coded, we've made it very just easy digestible content so that you don't have to feel confused when you're doing this. It is step by step. It shows you normal escalated values. Then we'll go to, say this is an individual that has a new diagnosis of diabetes and they want to know more about managing diabetes type 2. We have a complete guide on what type 1 versus type 2 pre-diabetes, some blood sugar levels, kind of goes over the A1C, and then some very useful nutritional meal planning, some physical activity, ways to better their outcomes and manage their condition. We also have some medications for type 2 that are commonly prescribed, and say that you commonly are having really adverse effects from one medication. We always want to that you know that your provider probably knows best and that you need to support their decisions. However, these might be things that you could bring to their attention and you might be a potential candidate for. And then, as well as we want to help individuals prevent complications and educate them on what's going on with the disease process of diabetes. So, like checking feet daily for cuts and blisters or changes due to improper healing. And of course, we always want you to know, we really want our patients to know when to seek medical help. We have it at the bottom here. If your blood sugar is very, very high, if you have any severe confusion, just really things to keep in mind. And those are all here in our resources, and we have a plethora of different options. Or you can use our Ask a Health question, and it'll easily sort and try and find information for you. Now, going to our profile section. It is very, very basic. We want to just keep the most minimal amount of information just to make this app work for you. But the thing that I really love is that this app is offered in 10 languages, everything from English to Dutch to Spanish to Tagalog, Russian. It is universal, and we want to be able to help patients from everywhere. And of course, we have a few different color waves. It's always very fun to see what people come up with. It's just personal preference. I personally really like the blue, but maybe someone else likes the green. And this is Healthflow. I'm very excited, and I hope you start taking better control of your health. Thank you for coming.